it's just too much at the same time. Because it's been days to where I can walk into a patient's room and there's 4 patients and I'm checking on one and I turn my back and the other one can be dead. It's a lot. And that did happen on my first day. I went to check in on one patient and I turned around and another one was dead.
Wow. So
And it's a lot to deal with on the first day.
Okay. Obviously, the vast majority of people will never get to fully understand how difficult that is, the stresses, the strains. And how was that first week? What kind of transpired for the rest of the week?
I wouldn't say there were any good days. There still were people dying and passing. It was just like, we got to the point where we ran out of body bags. That's how bad it was.
Wow.
My first week, I witnessed a doctor die on me.
A doctor?
Yes, I took care of a doctor and he passed on me.
Was that a doctor from the hospital or?
Not the hospital that I currently work at, but a hospital in New York.
Wow. Okay.
Yes.
And how have you felt supported through all this difficulty?
I feel the most support from healthcare providers due to the fact that we're in this together and we have each other's back. And I really feel like society forgets about doctors. I mean, I feel like the focus is on nurses, but I want to look at doctors as well because they have feelings just like we do. Just yesterday, I witnessed a doctor put the phone down in the middle of him telling a family member that their dad died. He couldn't bear it no more. He gets up, he yells, "I can't stand to keep giving bad news." So another doctor had to pick up the phone to finish the conversation. Doctors have feelings just like nurses have feelings. It's kind of bad news after bad news after bad news because these people are really sick. And the thing is, healthcare providers, we do not know the type of medicine to give these patients yet. It's kind of like a guessing game. I feel like maybe every other week, so this is my 3rd week, there's a different medication that I'm giving to try to help them. We don't know.
Wow, okay. And so you're talking about, obviously, other medical professionals have been ill. During your time, have you had anyone come down with the illness?
Yes, quite a lot, actually. My first week alone, just my first week here, a lady in administration at my hospital passed. Another lady in administration this week came to the ER and didn't get past the ER because she didn't make it. I have a PCA that worked at the hospital I work at has passed as well. 3 ER nurses have passed. There are currently ER nurses in the ICU that I work in now. And an ICU nurse that helped orient me for the 10 minutes I was in orientation was just admitted into the ICU yesterday. And not only that, travel nurses have started to have symptoms. Some of them are being forced to quarantine. So it's kind of like, it's everywhere. So not only am I having to protect myself from patients, I have to protect myself from staff.
Okay. So how about the personal protective equipment then? How's your standard of PPE?
So at the beginning, my first day, I was given an N95 mask and I was told that I'm only getting one N95 mask and this is to last me my whole entire assignment. My assignment ends in July. So that's roughly a little bit over 3 months.
And
one
typically,
mask, and typically
how long is it supposed to last?
not 3 months. Normally on a regular day, when there's not in a crisis and none of this is going on, you dispose of that mask. You get another one each time you go into the room, because we had the equipment, we had the supply, we had it. That's on a normal day. Now we're having to, at the beginning, before this got bad, we were using an N95 mask, taking it off and just putting it in a room and putting it in a bag. But now with everything how's going on, we leave that mask on our whole entire shift. But now that the governor in New York has made it, he's mandated that everyone has to have a mask, and that N95 masks have to be given to everyone every day we come to work. So the N95 masks have gotten better, but the gowns have not. I wore the same gown for an entire week. And then on top of that, we're sharing gowns. When we're done coming out of a room, we hang that gown up on the outside of that patient's room, so a doctor can wear that gown, or another nurse can wear that gown, or radiology, or whoever needs to go into that room. They wear that same gown, unless they found some gowns somewhere or someone's blessed them and sent them some gowns. That's the gown that they're wearing to enter into that room. And so people wonder how healthcare providers are getting sick.
And how do you feel? Are you feeling for your own safety? Do you have time to feel for your own safety? How does that work?
I can't make a mistake. I can't forget to put my N95 mask on. I can't forget to put a gown on before going in that room, along with some gloves, because this one little mistake could have put me at high risk. And not just at the hospital, everywhere here. Even going into the break room. I'm scared now to even go to the break room and take my mask off to eat, because so many staff members where I'm at are testing positive and are having symptoms. So I'm even scared to even eat in the break room. So I go somewhere else to eat lunch, if I do even get a lunch. More than 75% of the time, I don't get a lunch at work.
And how many hours are you doing a day?
Now I'm only doing roughly 13 hours.